Cameroon is one of the 53 countries that form the African continent. Cameroon is found in West Africa. Cameroon has a population of about 20 million, and it is compared to the size of California. Here is a picture of St. Elizabeth Hospital, where the initial part of the project will be carried out. Shushan Hospital has 350 beds, 11 permanent doctors, more than 300 employees, with 100 patients visiting the hospital daily for medical assistance. Children with deformed legs are under treatment with the sisters. A child before coming to the hospital, the same child after surgery and physiotherapy. The cardiac unit at St. Elizabeth Hospital is the only center where patients with congenital diseases are treated in West Africa. This is the only cardiac hospital in the whole of West Africa. The unit has 50 beds, about 25 employees, and approximately 30 patients come in daily for consultation and more during screening periods. Some of the problems we face are instability of power supply and internet connections, lack of computers in the hospital, lack of electronic medical records as everything is handwritten. You can see here how Dr. Lee Roche and his wife Susan had to push a car when they visited Cameroon in the summer of 2008. Lack of good roads make it difficult to travel. You can see 7 men pushing the hospital van out of the mud, a poor road leading to one of the remote clinics, and a bridge poorly designed. There is a need to connect the hospitals and clinics, a need for laptops and desktops for use in the hospital, a need for good power supply, a need for a telephone system, a need for Cat5 cables and software packages, including electronic medical records, MS Office, operating systems, antivirus, and backup facilities. The impact of computer technology will allow communications between hospitals and clinics, improved patient tracking and hospital information systems, assistance to students in the nursing program to have access to the internet. The intended display of equipment as they are laid out at Shushan Hospital. This shows the location of servers, switches, routers, desktops, and laptops.
At the beginning of the spring semester 2012, the instructor of the Network Service and Support class, Don Tessing, introduced the various options to the students for a capstone project for the class. The students agreed to do a project for Cameroon to help us configure servers to be used at St. Elizabeth's Hospital in Shushan. The students formed 5 teams to carry out this project. The groups were an Active Directory team, a grants team, a hardware team, a shipping team, and a software team. Each of the teams came up with a project plan to enable them to finish the project by the end of the spring semester. 3 servers, a rack, and spare parts were donated. Switches, wireless access point, and UPS systems were donated by the Western Technical College IT department. The students worked tirelessly configuring these servers. One server is configured as a file and print server, which will be used to store the database for the hospital. The second server is an exchange server to handle email. The third server has not been configured. This one is intended for use at the School of Nursing. It will be configured according to the needs of the school. The intranet, a system used only within the main hospital at Shushan, works well with the email client of Microsoft Outlook running on PCs. When the setup is completed at the hospital, the employees will be able to communicate with each other through email without being connected to the internet.
Cameroon Healthcare and Technology Project is an important opportunity for us to help Franciscan Sisters in Cameroon, a very, very important, compelling network there to do some things to connect the health services and the clinics that they have throughout the country. People who have never been to Cameroon may not realize that we're talking about an African nation with very poor road conditions, particularly in the remote rural areas. And there's a pervasive sense of poverty as well as health issues that are much greater than they are in a typical setting in the United States. The combination of the access issues and the need for advanced health care is a challenge that we feel we can help meet if we have better technology connections all throughout the country. It's wonderful that Sister Kathleen and Sister Virgilia were able to come to Western Technical College to learn more about computer networking services and other technology support, because when they graduate and they return to Cameroon, they're going to be able to provide these resources that's going to touch the lives of many, many people.
The needs for the continuation of this project are as follows: licenses for Server 2008, licenses for Microsoft Office and Exchange, licenses software for electronic medical records, laptops, Cat5 cabling for network, and especially and most immediately, funds are needed to ship the equipment to Cameroon.
We thank Dr. Lee Roche for discovering the projects, the Franciscan Sisters of Perpetual Adoration for providing us with a home away from home, the Friends of Cameroon for their relentless efforts towards our education, and the benefactors for your constant support. We thank our instructor, Don Tessing, for accepting to carry the project as a class. We thank the students for working relentlessly towards the success of the project. We thank Western Technical College for donating switches, access points, and UPS systems. We thank local companies for donating the servers, rack, and spare parts, along with 2 laptops. And here we are today, graduated and ready to put into practice what we have learned at Western Technical College.
For more information on how you can help, please contact Western Technical College Foundation, 400 7th Street North, La Crosse, Wisconsin. Phone 608-785-9487. Email is foundation@westerntc.edu.